Muy buenos días y bienvenidos a
Good
esta sesión.
morning and welcome to this press briefing of the Pan American Health Organization on the COVID-19 pandemic in the region of the Americas this Wednesday, April 14th, 2021. I am Sebastián Oliel from the Department of Communications of PAHO, and as every week, this session will last approximately 1 hour, and we will be taking questions from you up until that point. We have already received your questions through email, and you will also be able to ask questions live and also asking them through the Q&A button. Please always include your name and medium when you send your questions. Let me remind you that we have simultaneous interpretation into English, Portuguese, French, and Spanish, and you will be able to use interpretation using the interpretation button, which is a globe. Today, Dr. Carissa Etienne, Director of the Pan American Health Organization, will talk about the evolution of the pandemic in the region, the vaccine deployment, and the necessary response to prepare against spread of COVID-19. Dr. Etienne is accompanied by Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Director of Health Emergencies of PAHO, and Dr. Sylvain Ardigueri, Incident Manager of COVID in PAHO. I will invite Dr. Etienne now to share her words with us. Dr. Etienne, over to you.
Good morning, and thank you for joining today's press briefing. Let me begin with a reference to the eruption of the La Soufrière volcano in St. Vincent and the Grenadines. And we wish to extend our solidarity to the government and peoples of St. Vincent and the Grenadines. Let me note that PAHO has deployed 5 public health experts to St. Vincent and the Grenadines, and we are responding to the emergency in coordination with the Ministry of Health and the support of partners. In the last week alone, more than 1.3 million people have become infected with COVID-19 in our region, and nearly 36,000 died as a result of this virus. Since the pandemic began, 57 million cases have been reported in the Americas, with more than 1.3 million deaths. South America continues to be the epicenter of the pandemic in our region. The recent spike in cases in the Amazon is also seen in neighboring states, and today, Brazil, Colombia, Venezuela, Peru, and some areas of Bolivia are seeing a sharp increase in COVID cases. After the introduction of new variants in the Guyanas, cases have accelerated in French Guiana and Guyana. Further south, Paraguay, Uruguay, Argentina, and Chile are all continuing to see a rise in infections. In the Caribbean, Cuba, Puerto Rico, and smaller islands like Curacao, Bermuda, and Aruba are reporting a rise in new cases. In North America, infections continue to increase in Canada. Hospitals across the country are reporting a jump in hospitalizations among populations under 60, raising concerns about the capacity of health systems to withstand the expected rise in cases following the spread of the P1 and the B117 variants. This rise in infections across the region is alarming, but frankly, not surprising. Highly transmissible variants are spreading, and social distancing measures are not as strictly observed as before. As a result, there are more and more reports of crowded hospitals, shortages of medical supplies, and challenges in providing proper care for patients. With this in mind, it is time for a reality check. We are not acting like a region in the midst of the worsening outbreak. More people have been infected with COVID-19 in our region in the last 7 days than most of the weekly case averages that we saw last year. And our weekly deaths outnumber those of any week in 2020. Despite ongoing transmission in many places, restrictions have been relaxed. Crowds are back, and people are gathering indoors and taking public transportation, often without masks. We need to remember everything that we have learned about how dangerous this virus is and what we can do to stop it. I cannot stress this enough. For most countries, vaccines are not going to stop this wave of the pandemic. There are simply not enough vaccines available to protect everyone in the countries that are at greatest risk. Therefore, we need to stop transmission by any means possible with the tools that we have at hand. This will require comprehensive strategies to both accelerate the rollout of vaccines and control the virus using proven public health measures. The Americas have administered more than 247 million COVID-19 vaccines thus far. Since March, PAHO's revolving fund has helped to deliver more than 3 million doses on behalf of the COVAX facility to 28 countries in our region. But over the last few weeks, the suppliers of COVAX vaccines have run into constraints, so deliveries have slowed. And it will be a few weeks before supplies normalize. PAHO is actively working to support countries to make the most of limited doses by considering their limited shelf life and the vulnerable populations that should be protected first. At least 10 different COVID vaccines are in use across our region. The 4 vaccines authorized by WHO, the Pfizer BioNTech vaccine, 2 versions of the AstraZeneca Oxford vaccine, SK Bio and the Serum Institute of India, and the Janssen vaccine are already helping to prevent severe disease and deaths in places where they are in use. Rare reports of blood clots among individuals with low platelets revealed by strong vaccine surveillance systems are now being reviewed by regulatory agencies, and we expect additional recommendations soon. In the meantime, it is important to continue to administer AstraZeneca vaccines where they are available. Almost 200 million people around the world have received AstraZeneca's COVID-19 vaccine, and the reports of adverse effects are very rare. These vaccines can save your life and the lives of your friends and family. In the meantime, we cannot rely on vaccines to control transmission. After all, many countries were able to drive down infections last year before there were any vaccines on the market. We need better collaboration between and within countries by ensuring that national and local authorities work together to track and control the number of new cases and hospitalizations. Leaders at every level have a crucial role to play to stop this virus from spreading by tightening measures at the first sign of mounting infections and maintaining those measures until it is safe. For this to work, we need leaders to work hand in hand towards this shared goal. Ultimately, we must all work together to reduce transmission in the region and expand equitable access to COVID vaccines. Solidarity and Pan-Americanism is more important now than ever. PAHO is committed to working with member states to secure more vaccine doses for our region as soon as they are available, to complement what countries have already purchased via bilateral deals and through the COVAX facility. We will be here for countries at every step of the way, providing technical support to troubleshoot roadblocks, to increase surveillance, and to monitor the safety and impact of COVID vaccines. But we cannot work towards the future at the expense of the present. COVID is actively spreading everywhere in our region, and we all have a shared responsibility to stop infections, to protect ourselves and our communities. Remember, none of us are safe until we are all safe.
Muchas gracias, doctora Etienne. Vamos a
Thank you
pasar.
very much, Dr. Etienne. Now we will go to questions and answers. And let me remind you that you can write through the Q&A button, and please write your name and medium. There's a first question from Gabriela Granados from NHK for Mexico and Central America. The Japanese medium says, knowing that distribution of vaccines depends on the supply, for when do you estimate that COVAX will get to 10% of the 20%, which is their goal of protection for the region? And at the current rate, if there is not equal and equity in access of vaccines among the countries, by when do you think most people of age would be vaccinated in Central America and the Caribbean? Dr. Barbosa. Thank you for your question, or for your questions. As our director underlined, equitable access is an essential topic. If we take a look at the world today, for example, comparing North America, about 20%, 24% of the population has received at least one dose. If we go to Europe, at least 16% of the population has received one dose. In South America, only 9.4% of the population has received at least one dose. Equitable access is key not only to guarantee equity for countries, but also because to effectively control transmission, to avoid new variants, it is very important that there is balance all over the world in access to vaccines. COVAX facility is having difficulties at this point in time. There have been challenges because the manufacturer of AstraZeneca in India had problems to receive the export license so that it could be shipped to other countries. Also because the AstraZeneca manufacturer in South Korea had to reduce their capacity to less than 50% for February and March shipments. So we are trying to widen access through COVAX. AstraZeneca is beginning, or it will begin to deliver through two new manufacturing sites, one in Italy, one in Spain, which will increase production. But in fact, up until June, access will continue to be very limited. Vaccines are already committed. The manufacturers have already committed 20% of the population of all participating countries. That's their commitment. But if the current trend, where most shipments, about 70% of shipments, will be happening starting in June. So by the end of April and end of May, we will still have a limited access. So it is very important to guarantee that there are rules and agreements that may facilitate access of Latin American and Caribbean countries, that they can be guaranteed access. We are the region with the highest level of transmission. So it would be great to guarantee that in addition to public health measures, access to vaccines should become more equitably, that manufacturers won't be prioritizing only the agreements that they made with developed countries, but that they could be more equitable in is providing the vaccines that they have already committed to. Thank you. Thank you, doctor. The next question is from Sofia Villamil from this bureau in the New York Times. There are several questions here. There are several countries in Latin America experiencing a third upsurge. Why is this happening? And also, what is the role of the variant from Brazil in countries such as Colombia and Peru? And the other question is Brazil the super transmitter in the region? The story is more complicated than that. And she wants to know how bad the situation is currently vis-a-vis last year. Dr. Aldeguerri, this one's for you. Over. Thank you very much. Thank you for your question, or several questions indeed. Also, there are many answers that have been already mentioned by Dr. Etienne in her remarks. I think we have a whole set of factors that have come together and which explain these upsurges. And I'm going to use three criteria. First of all, during 2020, the virus was able to get to the last corners in the continent, the farthest town or village in the Amazon basin. And transmission continued in a detectable form by surveillance systems, but also under the radar of those same surveillance systems. The second criterion is that there has been an evident realization in the implementation of public health measures, even if people are within their closer environment. And there's been a great deal of mobilization during the holidays at the end of the year, and they have extended to Carnival and then ultimately Holy Week and the Easter week breaks. And now the emergence of more transmissible variants has increased to an intensification of the transmission dynamics. This phenomenon has also been observed in Europe. Regarding the P1 variant, originally detected in Brazil, it has been found to have changes, meaning mutations, which can make it more transmissible but not more aggressive or lethal. On the other hand, the possibility that the immune response be less efficient against this variant of the virus is still under study. Now, with respect to other questions asked, or parts of the question asked, regarding the situation in Colombia, transmission of the P1 variant has been relatively limited to some departments of Colombia, being detected mostly in the Amazonian region of the country. But this is not the variant with the largest distribution nationwide. Now, regarding Peru, while there has been an increase in the number of cases possibly associated to the P1 variant in the tri-border area between Brazil, Colombia, and Peru, we cannot exclusively ascribe this transmission or the increase in cases cannot be attributed exclusively to the presence of this variant. So the situation is more complicated. Whatever the variants involved in the current upsurge regarding the different ones that have been circulating since last year, the virus has the potential to cause great havoc and extend the capacity and overwhelm the capacity of our health systems. So how are we approaching this in our organization? We are in a point of a high risk of having more significant upsurge than in the year 2020, and our approach is to continue to provide support as we have. I hope I have solved your questions. Thank you, Doctor. The next question is from Julia Simiskov from Reuters in Colombia. Julia, I am going to give you the floor so that you can ask your question live. Yes,
Muy
Julia.
buenos días, ¿cómo están
Good
todos?
morning. How is everyone?
Yo quería
I
preguntarles
wanted to
si
ask
gobiernos regionales
if
deben instituir
should regional
medidas
governments
de
institute stricter
confinamiento estrictas
lockdown
si
measures,
algunos
and
países
which
como Colombia
countries
tienen
particularly
medidas más
need
estrictas en
more
cuanto a
strict
limitación
measures, and which
de
measures should these be? Thank you very much. Thank you, Julia. Dr. Ugarte, over to you. Thank you, Julia, for your question. It is a very important question, especially given the conditions mentioned by our director in her initial remarks regarding increase in the number of cases uh, in many countries of our region, considering that there is, or if we were to have detailed information regarding the transmission information in the health systems in the countries, it may it might be possible that countries using the risk analysis using different alert systems like the traffic light, the red, yellow, green, um, it is absolutely necessary to decrease the way in which the virus is transmitted, and therefore we need to consider that these decisions need to be localized in the geographic areas where there has been an upsurge of transmission and overwhelming of the health systems in the area. Measures implemented throughout the country, on the other hand, have very severe socioeconomic impacts. And experience has told us that using those extreme measures, including strict uh, restriction of movement or other mechanisms and closing of the economy, these measures should be applied locally, considering the saturation of health services and transmission levels in those local areas. We also should consider that when we analyze the status of the pandemic today and how cases are being transmitted, new cases of COVID-19, and we see that hospital beds are increasing, that the age of people that are falling ill is increasingly younger, but that as a whole, the number of deaths is also increasing due to the fact that the healthcare services are being overwhelmed. Clearly, all of this makes us think of those measures, but remembering always that stricter measures have to be implemented in areas where there is greater transmission and more overwhelmed hospital systems. And it is not easy to make that decision. And of course, those very strict measures need to be restricted in time too, when statistics show that there is a very high number of cases and there is a large number of deaths as well, then this could be too late. Analyses need to be made and decisions need to be made before getting to that point. It is a big challenge, but it is something where national authorities, local authorities, with the support of PAHO and other partners and agencies, they're all together making the decision. And I think this will be the story of localized, sometimes simultaneous outbreaks, some that are out of control in the countries. So while we have enough vaccine available, these outbreaks will continue and we need to pay attention as the discipline of the population by respecting and implementing the public health measures and the burden of authorities to continue to inform and to foster the use of measures for everyone, not only for those who are ill with COVID, but others who have other diseases, comorbidities, who are at risk of dying or of having more serious disease? This question is very timely, and the countries are really thinking about it and discussing and coming up with plans. Thank you, Dr. The next question is from Tanya Smith-Cartwright from the Bahamas Tribune, and it is in English.
What does the new negative developments about blood clots found in some people who took the J&J vaccine mean for this region? Will that slow down the distribution of vaccines? And have you already started distributing J&J vaccines in the region? Dr. Barbosa?
Thank you for this question, Tanya. Let me start by the last one. No, we haven't started the distribution of the Janssen vaccine or J&J vaccine in the region. It will start in June or July. We are in negotiation with the producer to establish the final agreements to receive these vaccines. It's important to clarify that when a vaccine presents all the data related to the preclinical and clinical trials, they present a lot of information about the safety and the efficacy of the vaccines. These data are thoroughly assessed, evaluated by the regulators, and when they release a license to a vaccine or the authorization for emergency use, they look into the data. The benefits of the vaccine outweigh any risk that these vaccines can present. This is the same procedure that the regulators use for any vaccine or any medicine that is used by the population. Every medicine or every vaccine can present some side events. The problem is to see if these events are in a number and a proportion that is acceptable, if they are expected or unexpected events. So what we have with the Janssen vaccine is a very important evidence that the surveillance system to identify unexpected events is working very well. We had a small number of cases, very rare events that were detected. The United States decided to pause the vaccine use for a couple of days while they are reviewing the data. This is not this is the standard procedure. Remember that in February we had a similar situation in some countries, Norway, Finland, with the Pfizer vaccine. They paused the use, and after 1 or 2 weeks, when they finalized the evaluation, and it was totally clear that the deaths that were reported were not related or caused by the vaccine, they restarted to use the vaccine. So this is the process now. The US is reviewing the data. WHO is following, receiving all the information. WHO still recommends the use of AstraZeneca and Janssen vaccines because clearly the benefits outweigh by far any possible risk. Let us remember that COVID-19 is a very severe disease that is producing hundreds of thousands of deaths in the world. It's important also to acknowledge that we have now more than 734 million doses applied from the different vaccines that are available in the world. So we are talking about very rare conditions that are still under investigation. We need to establish if they really have a relationship with the vaccine. After this process being completed, the WHO will make a recommendation. But now, again, we don't believe that we have evidence that the vaccine should be suspended. So the recommendation is to continue using and to continue strengthening the surveillance system to identify any event and to ensure that these events will receive scientific sound based review by the technical experts in order to give the final recommendation for the use of these vaccines. Thank you.
Gracias, doctor. Las siguientes preguntas están vinculadas con jóvenes y vienen de
Next few questions come from Carlos Serrano, BBC World, and Lucian Miguel from La Nación in Argentina.
¿Es correcto decir que a nivel mundial son los jóvenes?
The question is whether it is correct to say that it is the youth, the ones that are getting COVID-19 the most. What is the reason? And also, why is it that you consider that in some countries in the region, such as in Brazil and Chile, the virus is affecting severely the young population, whereas in other nations that is not the case? Dr. Aldiguieri, thank you for those questions from La Nación and Venezuela and BBC. Let me focus on the Americas, on the region of the Americas, starting in the early weeks of 2021. We have seen an increase of cases of admissions to hospitals and deaths among the young people and also adults in several countries. We have also seen an important increase among the young population between 10 and 24 years of age, and also in adults between 25 and 59 years of age in Argentina, Brazil, Canada, Chile, and the US. And we also saw an increase in the number of hospital admissions for the same age group in Brazil, Canada, and the US. To prevent transmission among young population and adults, and it is important to consider that the increase of cases in those groups, in those age groups, could be linked to the perception of risk. That risk perception could have diminished due to economic or social pressure, and also a false sense of security due to the onset of vaccination campaigns. Now, going back to Brazil. In Brazil, in January to April, the first quarter, more than 374,000 cases of acute respiratory syndrome were reported. Out of those, 66% were confirmed by lab to be COVID-19 cases. Out of those confirmed cases, the information we have is that the younger than 20 represents only 20%. The 20 to 39 group represents 12%, and the 40 to 59 years of age represents 34%. Now, as to hospitalizations, it is important to highlight that there are important changes based on the countries. In the case of Brazil, it seems that the age at the time of hospitalization was reduced in several regions, such as in the Amazon areas in particular. And over the last couple of weeks in Brazil, the age group that has seen the highest rate of growth for hospitalization in ICU was first for those between 30 and 39, second, those younger than 20, and finally, the 40 to 49 years of age group. So this phenomenon had been seen in Brazil as of January with the surge in the Amazon areas, and we saw this in several areas, and I hope I have addressed the questions of our colleagues. Thank you. Thank you, Doctor. The next question is by Linda Straker from Now Grenada, and in English it reads,
Vaccination, which island might reach herd immunity first in the CARICOM? Doctora Etienne.
Thank you, Linda, for this question. And this gives us an opportunity to clarify a few things related to how we are approaching herd immunity. It has long been established that vaccines are our best tool to prevent infectious diseases, both from an individual and a community standpoint. When we take a COVID-19 vaccine, each one of us has a less chance of developing COVID-19 symptoms and a much lower risk of developing severe disease, which is remarkable. More importantly, when many are vaccinated in our community, we reduce infection rates and the risk of transmission for all. And this is what we call herd immunity. So we will eventually get to herd immunity in our region when enough doses of vaccines reach every country. But it is hard to predict at this point how many need to be vaccinated in each country to get to that point. 70%, 80%, 90%. We will know when there are barely any new infections and that it stays that way. But let me remind you again that our immediate goal now is to save lives by protecting health professionals and those that are more vulnerable to severe COVID-19. And that's why each country developed a plan that allows them to use the vaccines that they have at hand. We indeed are very encouraged by the rhythm of vaccination in several Caribbean countries and territories. It shows that when enough vaccine doses are available, that governments have been able to roll them out quickly and effectively. PAHO has a tracker for immunizations in the region, and several islands are doing very well, with the Cayman Islands, Bermuda, Aruba, Bonaire, and Anguilla having covered more than 30% of their population, a remarkable feat. Of course, those are small populations. In order to reach herd immunity in our region, we need to continue to work hard on expanding vaccinations in every single country. We need to make the most of the supply that we have for now, and we need to continue to rapidly increase coverage as more doses become available. Thank you.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. We have several questions about Venezuela. They are requesting some sort of update as to the situation in Venezuela and vaccination. Mariana de Barrios, Gabriel Bastidas, among others. Mariana is saying, what vaccine was requested by the government of Nicolas Maduro for the Venezuelan people during their meeting with directors of PAHO, and what is needed for the vaccines to arrive to the country, and when will that deployment get to the country? When will that shipment get to the country? Dr. Ugarte, thank you very much. There is no specific request of vaccines. However, it is the vaccine that is available as soon as possible. It was analyzed that the scientific committee in Venezuela had reviewed the situation, and the AstraZeneca vaccine had been assessed as an unacceptable vaccine at this point. Therefore, Venezuela, or the administration of Venezuela, as well as the authorities in general, are convinced that it is necessary to have the highest number of vaccines available and as soon as possible. And to that end, there is a general effort, and I see that in this case we need to highlight the work, the efforts of the academic sector, the administration, the opposition, and other national and international actors for Venezuela to have more vaccines as soon as possible. Thank you. Thank you, doctor. The next question is by Norberto Paredes from the BBC, and he says that there are reports that Haiti and Venezuela have rejected doses of the AstraZeneca vaccine offered through the COVAX facility, and he's asking what is the position given this denial to accept the vaccines, and what has been the response given to these governments. Dr. Barbosa. Thank you very much for your question. Indeed, I think that it is even important to highlight, and my colleague Ciro Ugarte already mentioned, you have mentioned what is most important, to have the fastest access to vaccines. And here we have two different situations. Haiti is a country that is one of the countries supported by the facility, that is to say, countries that are going to receive vaccines without the need to pay. PAHO, the regional offices in Haiti have been working intensively with the country. It is a country that has difficulties because of the political financial crisis, but they have been working with the country to have a vaccination plan ready, and that was one of the conditions to be able to receive the COVAX vaccines, to implement the regulatory legal changes to sign the clauses of the contract. So far, the government of Haiti has reported that they are not receiving the AstraZeneca vaccines. There is no possibility to move on to a different vaccine in countries that are supported. That is to say, we are working with the government of Haiti, with the ministry, to show them the data, to show them the safety of the vaccine, to be able to recommend this from PAHO, from WHO and the European authorities, so that they can receive the vaccine. If the country confirms that they are not going to accept the vaccine, those doses that are already reserved for Haiti are going to be reallocated to the other countries that are participating in the facility. We think that this may be an important loss for the country, and that's the reason why we're working with the Ministry of Health to provide all of the technical information that is needed. The situation in Venezuela has already been clarified by my colleague Zero. We are also working to attain the necessary funds for payments, and the government at the outset said that they were not interested in using the AstraZeneca vaccine, and we're working with the ministry also to provide all of the data, all of the recommendations, so that the ministry can make a decision based on evidence, the evidence we currently have, and also the recommendation by the committee, the experts committee, the independent expert committees of WHO that has all of the safety information on vaccines, as well as the data from the European Medicine Regulation Authority, EMA, and they are also assessing everything that happened with AstraZeneca vaccine in some countries in Europe. So these are unusual cases, and they are being very rigorously followed and reviewed, and it is important to guarantee access of individuals to vaccines. Clearly, they may save lives because the vaccines are going to be used for the most vulnerable population, and also the individuals that have chronic diseases, the elderly. So we are working with those countries to clarify, share the information, the scientific information we have that justify the use of the vaccine. Thank you. Thank you, doctor. The next question is by Manuel Lino from F Central in Mexico and Blanca Valadez in Mexico. Manuel is saying that one variant was detected in October 2020, and that for February 2021 it was present in 87% of the sample sequenced in the country. He's saying that it is not considered to be a variant of concern, and he's saying, how can you decide that that is already a variant of concern, whether this is something done by PAHO or whether this is done at the country level? And also, Blanca is asking, when and in what degree could a variant of concern be qualified as an outbreak or a concern in a country? I thank those questions from Mexico regarding the variants, and we are informed of the findings by the Mexican scientists. First of all, the B11222 variant has been reclassified with a different number, B11519. It is important for scientists or journalists that are going to search the global database to use this new name to be classified as a variant of concern, VOC in English. There should be sufficient evidence beyond a sequence that shows an increase in the transmission capacity and/or a change in the clinical form and/or higher virulence and/or a negative impact on the diagnostics methods or the reduction in the efficacy of the control measures, including vaccines. Even though the increase of cases attributed to that variant B11519 has been documented in Mexico, it has been attached to an increase in the number of cases. This is an expected process that has been observed in other regions of the Americas and also in other regions of the world. However, given the molecular characteristics and the changes identified, that variant has been classified as a variant of concern. How does the classification work? There is a genomic team composed of experts at the level of WHO. These are global experts from PAHO, from the WHO, from the Americas and from Europe, and this group is reviewing the background and the evidence available for each variant that has a potential impact on public health. And this group also suggests to classify this as a variant of concern or as a variant of interest. So, and there is permanent follow-up. Now, the last question, when a variant of concern could become an outbreak or a danger to the community, we need to maintain genomic surveillance in close contact with epidemiological surveillance. Any changes to the clinical form of the disease, severity or lethality, or also a lack of protection from the vaccines, how can we, and when we can show direct relationship to the variant, that could pose an additional danger to the country, to the region, and to the world. I hope I have addressed the questions. These are complex topics with very particular language. Thank you. Thank you, doctor. The next question is by Lidia Lopez from La Prensa in Nicaragua. She's saying that Nicaragua reported to PAHO how many people were vaccinated in the first campaign of vaccination against COVID-19, and she would like to know what would be the impact of the vaccination process on the delivery of vaccines by COVAX due to problems with the producer in India. Dr. Ugarte, thank you very much for the question. Vaccination in Nicaragua against COVID-19 started on April 6th, and the authorities reported that they would be having availability for more than 177,000 individuals. The priority group, as it was indicated, encompasses people older than 70 with comorbidities and chronic diseases, and the authorities have presented a schedule for vaccination, and the vaccine will be applied in the country. In some countries, there are some extended wait times, and we have also seen that in most places the individuals are using masks, and we also think that it is prudent to review in those areas the conditions to be vaccinated. So far, we understand that the vaccine is proceeding orderly. The record is also maintained digitally, and we see that the individuals that have been vaccinated are satisfied with vaccination. We do not have precise information on coverage. We do not have precise, accurate data on age groups or individuals based on location. We think that the government will be sharing this information widely, This is one of the pieces of information that is necessary for the population, but also to be able to continue with vaccination and the application of the national vaccination plan. And we are also seeing that there are some patients that received the Sputnik vaccine who have chronic diseases, and now they continue with the AstraZeneca vaccine from India. Indeed, the reduction in the production or availability of the vaccine produced by the Institute of India will not only impact that region, but the region as a whole. And the reason is that India has an increase that is quite significant in the number of cases, and they are giving priority to administering the vaccine within the country, and that limits access to the vaccine by other countries. And in the case of the region Nicaragua, that is the country that receives those vaccines through COVAX facility as a donation. Thank you.
Doctor, la siguiente pregunta de
Thank you,
Sofía.
doctor. The next question is by Sophia from New York Times, and she's saying, if Latin America cannot control the virus this year, how is this going to impact the global fight against this pandemic? Dr. Barbosa, thank you. Thank you very much for such an important question. Before answering, let me just add something to the question from Nicaragua regarding diagnostic testing prior to the vaccine. There is no recommendation to carry out diagnostic testing before the vaccine for anyone, even for those individuals that already had COVID-19. There is no need to test. Individuals need to respect the strategy within the country, the priority groups that in general are the ones that are the most exposed, the health workers and also other workers from front lines, the elderly, and also the elderly and individuals with chronic diseases. But they should receive the vaccine without the need to be tested before. As to the question regarding what it could represent for the world if there is no equitable access, this is clearly a very important issue, because if we are unable to control the situation with equity throughout the world, we're always going to have the possibility for new variants to come up. And new variants make it impossible for us to predict the behavior of the virus in relation to the original virus. We don't know whether this variant will be higher transmissibility as some that have been already identified, or they could be variants that could produce more severe cases, more cases and more severe, which is also going to be difficult for the health services and systems. And we are also identifying some, as we are seeing in some studies. But the worst scenario is that if there is a new variant that is not protected by the current vaccines. So to have equitable access throughout the regions and to attain control of transmission in Latin America, which is the epicenter, not only now, but for a couple of weeks now, it is the epicenter of transmission in the world. It is very important for that reason, so that we can support, and we also need to support the economic recovery of this region that has been tremendously affected by the pandemic in the region. Latin America and the Caribbean have been affected, and their economies are deeply affected by extreme poverty, but also for the health population at the global level. No country will be effectively protected if all of them are not protected. If one country reaches vaccination for 90% of the population, but transmission continues in other regions, it could be that a new variant comes up that is not covered by the vaccine, and that country would have lost all of the effort they have made with vaccination. So this goes beyond the moral, ethical need, but also a health need to have control throughout the world and also in Latin America because of their special condition that could cost the effort that the world is making, and that's important why we need to have equitable access. Thank you very much. Thank you very much, Doctor. And in connection with that, Anthony Fayola from the Washington Post sent a question in English.
Pandemic impacting on healthcare inequality and access in the region. Dr. Etienne?
Thank you, Anthony, for what is a very concerning question, and one that has the attention not only of PAHO, but many institutions, agencies, and most of our governments. You will know that it is very well documented that the Americas are the most unequal region in the world. Many of our countries are reporting a very stark income gap between a minority of top earners and a majority of poor families. These inequalities have long been reflected in our health systems, with low-income groups throughout our region often having a hard time to access the care that they need when they need it. And this has reflections across our health indicators, with the poorest within each society being more vulnerable to infectious diseases, as well as suffering the most dire consequences of non-communicable diseases. So, although we have seen COVID-19 affect every family, regardless of income and housing conditions, what is very true is that the poor have been at greater risk of getting infected and dying due to lack of appropriate care and lack of access to basic determinants of health. There is evidence of this impact from multiple small studies and reports within our region that shows that the impact of COVID has been harsher among racial minorities, urban slum dwellers, and informal workers. And this is an ongoing tragedy that we've been living with for the past year. The impact of the pandemic is such that no country, no government, no political leader can afford to look the other way now. We must face the burden of inequality, or our region will remain vulnerable to this pandemic and to the next one and to the next one. So I think that there are three things that must be done to ensure our health systems are more equal. We need now to embrace health as a right throughout the region, and to ensure that universal health access and universal health coverage is available to all, regardless of income and location. Second, I think we must invest appropriately in health. We call for 6% of the GDP to be invested in health by our governments. And this is the best investment, especially as we start to look at the work that needs to happen to ensure that our health systems not only recover, but that they are ready for the next pandemic. And we must ensure that at least 30% of that investment is at the first level of care. And third, we must expand coverage of primary health care. And this is a proven strategy to cover a broader population, not just in an emergency, but with the essential services that prevent people everywhere from getting ill and demanding more complex care. So this is what we need to focus on to get us through the pandemic, but ready to face tomorrow. Thank you.
Muchas gracias, doctora Etienne. Hemos llegado al final de la...
Thank you very much, Dr. Etienne. We have reached the end of the session today. Please remember that you can find further information on our website, www.paho.org/coronavirus, and you can also continue in contact with us through email. Thank you again for being with us, and let's take care of us. Greetings.